think we'll get started. Hi, everyone. I'm Emily Zanius, and on behalf of Herd and Rye, I'd like to thank you for joining us today to learn about forever plastics in our homes. We are excited to welcome Dr. Sarah Evans today. Dr. Evans is an assistant professor of environmental medicine and public health and member of the Institute for Climate Change, Environmental Health, and Exposomics at the Icahn School of Medicine at Mount Sinai. Her research focuses on the impacts of early life exposures to environmental chemicals on child development, and she is here today to help us learn what steps we can take to create safer environments in our households. Before we begin, Dr. Evans is not here to address the current debate around nursery field. We know that people are very passionate on both sides, and Herd and Rye is not taking a stance. Dr. Evans, thank you for being here.
Thank you so much for having me. I have a lot of information to share, so I'm going to jump right in and share my screen. Okay. How does that look? Well, let me know if it looks okay. Okay, great. All right, so before I begin, I just want to acknowledge the teams of researchers and clinicians that I work with at Mount Sinai. So I'm a researcher with the Institute for Climate Change, Environmental Health, and Exposomics. I'll tell you a little bit more about what we mean when we talk about exposomics as I go through my talk. And then I also work with a really incredible team of clinicians through our Pediatric Environmental Health Specialty Unit and our New York State Children's Environmental Health Centers Network. And I'll explain a little bit more about what all of these teams do. And I just want to acknowledge that we receive funding from both the state and federal governments through the NIH, EPA, CDC, and American Academy of Pediatrics. So at Mount Sinai, as I mentioned, we really work as a multidisciplinary team. So we are researchers as well as healthcare providers, community members, advocates, and decision makers who are all really united with the goal of preventing and treating diseases that result from environmental exposures and to promote safer evidence-based practices and policies. So we do programs like Educate the Public, as we're doing today, and we also advocate at the policy level for healthier communities. So the work that we do is really rooted in the fact that chronic diseases are on the rise. This data probably doesn't come as a surprise to many of you who likely know friends and family members who are impacted by any number of these chronic illnesses. So for example, 1 in 3 women and 1 in 2 men will develop some form of cancer in their lives. The rates of autism now are estimated to be 1 in 36 children, and those rates are even higher in boys. And so we know that our lifetime risk has really doubled or tripled for many of these common diseases in a relatively short period of time. In a way that really can't be explained by genetics alone, and suggests that there's something else at play here, most likely environmental factors. And so at the same time that we know that these chronic illnesses are impacting our friends, our families, our communities, we're really bombarded by news about harmful chemicals in our everyday environments that may be contributing to health problems. And some of these we've known about for a long time. I think many of you might have young children and may have been pretty alarmed about recent high levels of lead that were found in certain applesauce pouches. Lead is a known environmental toxin that we've been trying to get out of products for children for a very long time. And then we have these emerging exposures like microplastics found in bottled water, for example, and in air, and in many tissues of our body, like placenta, like lungs, like blood, emerging types of pesticides that are in foods that are common for children, gas stoves polluting our indoor air quality, right? So I think a lot of you probably came here today because you're seeing a lot of this in the media. This is to say nothing of social media. This is just the popular press. And so it kind of begs the question, what is going on? And so we know from studies that are done by the CDC through a study called the National Health and Nutrition Examination Survey, which looks at a representative population of individuals in the United States that there are over 200 chemicals that should not be in our bodies that are detected in our bodies. Many of these come from common products that we use in our homes and our everyday lives. They're likely getting in through the foods we eat, water we drink, air we breathe, and even through our skin with the products that we put on our skin. Many of those exposures are higher in children, and I'll talk a little bit about that. We do focus largely on children's exposures and their unique vulnerabilities in the work that we do at Mount Sinai. And then we also see racial and ethnic disparities for many of these chemicals as well. And these are really sort of chronic low dose cumulative exposure. So more than 200 different chemicals that get into our bodies at low levels. And so it can be really difficult to understand what the health impacts of this might be. And so for many of you hearing this information, this can cause a lot of stress. We feel like we live in this toxic soup of chemicals. And so I'm going to talk about a couple of examples of classes of chemicals that are common in our environment and how we're addressing those at Mount Sinai, what we understand about the health impacts, but really importantly, what you all can do about it. What steps can you take both in your homes and in your communities to reduce exposures? So one of the ways we talked about this word exposomics, which many of you have likely not heard of before, but one of the ways at Mount Sinai that we're really trying to make sense of this soup, as you can think about it, is through our Institute for Climate Change, Environmental Health, and Exposomics, where we think about how all these factors come together. So not just the chemicals in our environment or the pollutants that we're breathing, but our own diets, lifestyles, stress and social supports, for example, interact with pre-existing conditions that we might have, whether you're male or female, how old you are, and so on. All of these factors really interact with one another to determine your disease risk. And that's what we're referring to when we talk about exposomics. It's really looking not just at, for example, one chemical at a time, but how all of these things come together across the lifespan to influence your health. And so this is one really basic example of the way that we think about exposomics. And this is from a study that was overseen by Dr. Rosalind Wright at Mount Sinai, looking at air pollution and during pregnancy and the risk of a child going on to develop asthma. And we know that exposure to air pollutants during pregnancy does increase risk of asthma in the child. And so what was really interesting about this study was that when they looked at air pollution in women who experienced low stress during pregnancy, they didn't see any impact on that child's asthma risk. But when they looked at women who experienced both air pollution and high levels of stress during their pregnancy, they found that the child's asthma risk was influenced. So this just shows that we really need to think about social factors along with environmental exposures when we're looking at disease risk overall. And so we have a number of really exciting and emerging ways of Mount Sinai, of researching these things at Mount Sinai. It really requires a novel approach. And so we have a lot of studies that are looking, for example, at cohorts of pregnant women and then following their children to see how they do, using really sort of new methods. So measuring stress, using things like wearable devices, like silicone wristbands and apps to measure factors in real time in the environment. And then also going back in time, for example, using satellite data so that we can look at what weather, climate, air pollution was like during an individual's pregnancy and see how that impacts their child's health outcomes. And then we're also doing things like using novel samples like shed baby teeth, dried blood spots, hair samples to go back in time and measure chemical exposures that individual children might have experienced and determine exactly when those exposures occurred. So a lot of really exciting and complex emerging research that's happening in the labs. So all of that generates a lot of new ideas and findings, but what we really want to be able to do is bring that information to patients and communities, and we do that through partnerships with clinicians. And so we're really fortunate at Mount Sinai that we are the home of the Region 2 Pediatric Environmental Health Specialty Unit, which is part of a national network of healthcare providers who have expertise in environmental health. So many of you will find probably that if you go to your own pediatrician or physician, that they don't have a lot of knowledge base related to environmental exposures and environmental chemicals. That's not usually part of the medical school curriculum. And so the Pediatric Environmental Health Specialty Unit ensures that, that clinicians and health professionals are getting training in environmental health so that they can recognize, prevent, and treat diseases of environmental origin. And so we also, we operate an on-site environmental pediatrics clinic at Mount Sinai as well. In addition, and I'm really excited to be able to share with you all, because of where you're located, that we are part of a statewide network of children's environmental health centers that conduct environmental health screenings and referrals, trainings, and clinical consultations across the state. And we do have a center in the Hudson Valley, which is affiliated with New York Medical College, and works with physicians at Maria Ferrari Children's Hospital, at Westchester Medical Center, and Boston Children's Health Physicians. So through state funding, we've been able to really expand the ability of providers across New York State, including in Westchester, to counsel families about environmental exposures. And so lastly, moving out of the clinic, we feel really strongly about using the research findings towards promoting action and creating healthier communities. So that's sort of part of why I'm here today, talking to all of you to share the research findings and then what you can do to create healthy communities yourselves. So diving into why we're particularly concerned about children's health and children's environmental exposures is because we have identified, through research, certain windows of susceptibility. So it's not only what you're exposed to, it's when you're exposed to those things throughout your life. And we know that there are time periods where bodily systems are developing and developing more rapidly, and that makes them much more sensitive to certain types of environmental toxins. And so pregnancy is one of those periods, also infancy and early childhood, but even into adolescence and early adulthood, when the reproductive system and the nervous system in particular are still developing, it's important to think about the exposures that teens and young adults experience as well. And we have an expression in environmental health. We talk about the fact that children are not little adults, and often policies or regulations around chemicals are based on a full-grown adult, but children have very unique vulnerabilities and physiologies. So children breathe faster than adults, so they actually take in more air than an adult would, so they're more susceptible to inhaling pollutants. They're also closer to the ground. So anything that settles down in dust and soil, they're more likely to have an exposure to. They normally put things in their mouths. So their hands or other objects that are carrying contaminants can expose them. They eat less varied diets, but they also eat a greater volume and consume more water, pound for pound, than an adult does. So they're more likely to experience exposures through their foods and the things that they drink. And then again, like, we can't forget about developing teens and young adults who might be experimenting, with things like vaping, whose lungs and nervous systems and reproductive systems are also still developing. And so when I speak to families and communities like I am today, one of the questions that we always get is, what's the safest product that I can choose? Whether that's a mattress or a water bottle or a sunscreen. And unfortunately, those answers are not always totally straightforward. So it may come as some surprise. It often comes as a surprise to many people that manufacturers are not always required to test the chemicals that are in the products that they sell for safety. And it's really difficult actually to know even what is in the products that you buy. So ingredient listings that are required on foods, and in some cases, cosmetics, are not necessarily listed on cleaning products or furniture or toys or other products. And then the FDA also doesn't verify that product contents are what the manufacturer lists that they are. And then lastly, and this is a really sort of big barrier to understanding what's in the products that you use, there are trade secrets like fragrance, which can consist of hundreds of individual chemicals, as well as inert ingredients, byproducts that form, and contaminants that aren't necessarily going to be found on the label. A couple examples are one for dioxin and formaldehyde. Formaldehyde forms from a number of different hair straightening products. You may all be familiar with that. Those are two known carcinogens that are not intentionally added to a product, but that can be formed within the product, and it's very hard for consumers to know that those are there. And then in addition to it being so difficult to know what's really in the products that we use a lot of products. I use very few, but I can still list, 6 or 7 that I probably use on a regular basis. And so on average, adult women use 12 personal care or cosmetic products, and teen girls use 17. I think this data is now several years old, and I know that there has been, I think, a big uptick in the beauty industry that's marketed towards teen girls as of late. So these numbers might actually be kind of low. But so if we have chemicals of concern that are present in individual products, it's important to think about the additive or even multiplicative impacts of using so many products on a regular basis. And so when we talk about the 200 plus chemicals that are present in the body of most Americans, as I mentioned in the previous slide, many of these are of particular concern because they're what we call endocrine disrupting chemicals, EDCs, or hormone disruptors. And I think a lot of us think when we think about hormones, we think about the reproductive system. But actually hormones are like master regulators for the whole body. And so when you disrupt hormones, you can disrupt the brain, behavior, digestion, fertility, of course, stress response, heart rate, and so on. So they really regulate essentially every system of the body, and they're active at very low levels. So when we talk about these kind of chronic low level exposures to things that are present in our everyday products, they really don't need to be at very high levels. Often people say the dose makes the poison, and that's true. But for some of these types of chemicals, they can be active at very low levels. And so that's something that's important to keep in mind. And so I wanted to share a couple of examples of different classes of chemicals that you will find in many of the products that you use throughout your home. And some of the strategies that you can use to reduce exposures. And so the first one is a class of chemicals that a lot of my research has dealt with, and those are called phthalates. I know it has a very funny spelling. That's not a typo, that's actually what they're called. And they have been shown to be endocrine disrupting chemicals or hormone disrupting chemicals. And they interfere with sex hormones in the body as well as thyroid hormone. And so they've been shown to have a number of health effects. They're used as plasticizers, so they're found in any plastic that has a number 3 PVC or vinyl label to it. And these are things like, unfortunately, plastic rubber duckies, but also a lot of plastics that are used, for example, in the neonatal ICU that are used on vinyl flooring. When you hear about vinyl flooring, these are made from PVC and known to contain and release phthalates into the environment. Shower curtains, but also used in fragrance very widely. So in all types of air fresheners, perfumes, fragrance and cosmetics, and also sometimes to stabilize color in cosmetics and in nail polish. So present in many, many different products, also present in food packaging, which is thought to be a major source. And so when the CDC does those studies looking at, they actually look in the urine and the blood of Americans, and that's how we measure exposure. They find that essentially 100% of people who are tested have some level of phthalate chemical in their body. So, sorry, this is not going forward. Okay. So why does that matter? So as I mentioned, these are chemicals that interfere with with hormones in the body. And so some of the original studies that were done found interference with testosterone. And so there were malformations in how the male gonads formed, also reduced levels of testosterone, impaired sperm function, pregnancy loss, delayed puberty, early puberty, endometriosis. So interfering with the reproductive system in a number of different ways, but also associated with increased risk of obesity, asthma, allergy, eczema, and cognitive and behavioral deficits, which is what where my area of research has mostly focused. And one of the sort of insidious problems with phthalate chemicals is that they're not really bound to the product that they're in. So I mentioned that they're used as a plasticizer, found in many types of food packaging. There was a study that came out. I don't think I have a link to it here, but there was a study that came out just in the past weeks from Consumer Reports that found, I think, 99% of food products that they tested had phthalates present because it leaches out of the packaging that it's present in. So it's not tightly bound to the plastic, and it comes out. So not only does it come out of packaging and into foods and beverages that we drink, it also can come out of products in the home and get into dust. And so this is just a study showing that individuals who lived in homes that had vinyl flooring were more likely to have phthalates in their urine. These were children. And so, as I said, we know that these chemicals are in our bodies, and we have some good evidence that they're getting into our bodies through personal care product use, for example, as well as through diet. And so these are some studies that have shown that the number of products that an individual uses is correlated with how the levels of phthalates that are in their urine. So using a greater number of products, this was both for women and for infants, was associated with more phthalates in the body. And then a really interesting study of Mennonite women who really use no cosmetics or personal care products found that they had much lower urinary levels of phthalates. So really suggesting that that this is probably a route of exposure, whether that's through inhalation when you apply a product or through absorption through the skin. And so I know I'm sort of bombarding you with a lot of information. It's not meant to be scary. It's actually meant to be empowering, to help you understand how you can make change and decrease your exposures. And one thing that I will say about some of the chemicals that I'm talking about today is that they leave the body very quickly. So once you make a change in your personal product use, you can sort of rapidly decrease the level of chemicals that are in your body or in the body of your child or your family. And so the first kind of line of defense is to change your own behavior. And I'll talk a little bit about that. And I'll talk about how sort of pressuring the market can be a second line of defense that can be very effective. And then ultimately how we really need stronger regulation so that we know that the products that we're using are free of chemicals that might cause harm. So here are some of the suggestions that I have that you can use to avoid exposure to phthalate chemicals. And even though I'm talking about phthalates right now, but if you follow these steps, you'll actually reduce your exposure to a number of different chemicals. And so using fewer products is a great place to start. Choosing products that are fragrance-free. So I mentioned that fragrance can be a mixture of hundreds of chemicals. And so this applies to air fresheners, plugins, cleaning chemicals, personal care products, whatever you can think of that might have fragrance in it. There's a good chance that that fragrance contains not only phthalates, but potentially hundreds of other chemicals that can interfere with your health, that may also disrupt hormones in the body. So looking for fragrance-free is a way that you can eliminate exposure to a number of different chemicals. 3-free or 5-free nail polish, making your own cleaning product using baking soda, vinegar, and lemon, and that kind of thing, and choosing whole, fresh foods. So we really, we have good evidence that diet is a major exposure to chemicals, and particularly packaged and processed foods. And, as I mentioned, avoiding anything that has fragrance, as well as plastics that are PVC or vinyl, things like shower curtains, flooring, and toys. School supplies and backpacks are another product that often are made from PVC or vinyl plastics, not frequenting nail salons, avoiding packaged and fast foods, and cleaning up house dust. And again, house dust is sort of like a big bang for your buck thing that you can do, because many environmental chemicals that are released from household items will settle in house dust. And again, children are close to the ground and more likely to be exposed. So these are some of the general steps that we recommend in terms of eliminating exposure to not only phthalates but other chemicals. And I wanted to share some data that really supports the idea that if you change or eliminate some of your product use when it comes to cosmetics and personal care products, that you really can rapidly reduce your exposure to the chemicals that are in those products. And this is a study that was done with young girls who were told to use their usual products that they always use, and then they did kind of a swap out. And I think it was 5 or 7 days that they were told to use products that did not contain particular chemicals of concern. And I know there's a lot of data here, but what you can see here is where they're showing the percent change after the intervention of using these lower chemical or products that were free of chemicals of concern. And you can see that there was a change for most of these types of different classes of chemicals in these products. Most of them went down for the majority of girls. So not all of the chemicals and not for all of the girls in the study, which shows that we don't have 100% control over our environment. But I think, a really positive takeaway here is that when you start to look at the products that you're using and you make some small changes, you can really rapidly reduce your exposure. But as I mentioned, that study wasn't entirely effective in reducing exposures, and so we really need to promote action at the level of the manufacturer and at the policy level. And so this is just showing, these are some of the studies that I've worked on that looked at the associations between phthalates and health outcomes in children. And advocacy organizations put pressure, as I said, on the marketplace, and had a lot of success. And many companies have actually improved their toxic chemical safety programs. Examples here were Rite Aid and Target that are now screening their beauty products to make sure that they have fewer toxic chemicals. And then also at the federal level, in 2008, the Consumer Product Safety Improvement Act, largely due to some of the research that I described earlier showing the health impacts of phthalate exposure, limited the use of some phthalates, not all phthalates, but some in certain products that are marketed to children. So there has been progress there, and also some New York State level legislation that has passed that really were some major victories to make sure that toxic chemicals are not present in children's products. And at the very end, I'll direct you to some resources where you can learn more about how you can advocate. But this is the kind of thing that we really need to see to be fully protective. So I wanted to share a little bit. So that's sort of moving on from the realm of personal care products, beauty products, chemicals like phthalates, to talk about a really important class of chemical that's present in many of the products that we use in our home, and that you may have heard a fair bit about as of late in the media. And these are PFAS chemicals, or per and polyfluoroalkyl substances, PFAS. This class of chemical included the original Teflon chemical, PFOA, and you've also probably heard them referred to as forever chemicals. And that's because they really persist in the environment, which makes them even more hazardous. I talked about, phthalate chemicals, and a lot of the chemicals that we're exposed to today leave the body fairly rapidly. They may break down in the environment more rapidly. This class of chemical, many of them can persist in the body for long periods of time and also in the environment. They are a class of chemical that are very valuable in industry because they are grease resistant, water resistant, and stain resistant. And so that's why they're present in numerous types of food packaging, stain resistant fabric, water resistant clothing, rain jackets, and the like, but also present in things like cosmetics, pesticides, notorious for lining microwave popcorn bags, actually. And some do continue to be used, and even though we don't have Teflon anymore, that has been banned, but there are still other members of the PFAS family that are used for nonstick cookware. And this is because there are an estimated 15,000 different PFAS chemicals in this class, and sort of points to the idea of regrettable substitution that we talk about in chemical policy, where one product like PFOA may be removed from the marketplace, but is substituted with a very similar chemical with similar properties and likely similar health impacts. One of the challenges with thinking about this huge class of chemicals and how widespread our exposure is and what we can do about it is that at this time we measure something like 20 or less of this 15,000 member class in humans. So it's very challenging to have a full understanding of the health impacts. One of the reasons that you may be hearing a lot about PFAS as of late is because it is found in our drinking water. Again, we only measure, I think, at this time up to 25 out of the 15,000 that are possible. And this is a map, and you can see I have Westchester County in here as well, that you can find areas of PFAS water contamination through the Environmental Working Group. They maintain maps of PFAS contamination sites all across the country. There are currently no enforceable federal regulations on PFAS chemicals in drinking water. New York does better than the rest of the country. The US right now has a health advisory, which recommends no more than 70 parts per trillion of PFOA or PFOS. Again, only 2 out of the many PFAS family members, and New York sets a regulation at 10. But again, these are non-regulatory and non-enforceable. And so the US EPA actually recently acknowledged that there's likely no safe level of exposure to some of these PFAS chemicals and proposed new enforceable maximum contaminant levels. So this means that your drinking water should not have more than 4 parts per trillion, so a dramatic decrease from 70. For either PFOS or PFOA, and then they've included an additional 4 out of the many thousands that they will also regulate as a mixture. So this is really an emerging issue where many communities are likely to have their water flagged as being contaminated with PFAS. So what is the problem with that? The problem with that is that PFAS, like phthalates and other environmental chemicals, have been associated with impacts on many systems in the body. So they are associated with high cholesterol, thyroid disease, ulcerative colitis, kidney and testicular cancers, also increased COVID-19 severity. So there are studies showing that PFAS can interfere with the immune system in ways that lead to decreased vaccine response as well in children, impaired neurodevelopment and pregnancy outcomes. So again, a number of health impacts have been associated with these. So what can you do about it? You can limit takeout foods and microwave popcorn. So again, arguing for choosing whole and less processed foods. Stainless steel or cast iron and avoiding nonstick. It can be really hard to tell what manufacturers are using to line those nonstick pans. Avoiding stain-resistant and waterproof fabrics. Advocating, of course, and I'm going to talk a little bit more about that. You can check with your water company to see what the PFAS levels are, at least for the ones that they measure. And if they are elevated, you can use an alternative water source. You can look for that information on the Environmental Working Group website as well. And they also recommend filters based on how your water supply looks. And again, the same advice as I would give for a number of environmental chemicals is reducing dust in your home using a vacuum or a wet mop. And the other good news here is that since PFOS was banned, you can see a dramatic decrease from 2000 up to 2014 in the average levels of PFOS. Actually, yes, this one is PFOS in the bodies of most Americans. So this just argues that regulations, removing these types of things from products works, just like changing our own behaviors also works. And so because of all of this emerging evidence that exposure to PFAS chemicals is very widespread, but also that there's very hard evidence that PFAS exposure is associated with health problems, the National Academy of Science, Engineering, and Medicine recently released clinical guidance on what clinicians should do if they have patients who have a history of exposure or who come to them and say, I recently found that my water is contaminated with PFAS. What should I do? And so they can do a blood test, which will provide the sum of 7. They recommend looking at the sum of 7 common PFAS. And at less than 2 nanograms per mil levels in the blood, there's no follow-up needed. But based on what we know from epidemiological studies about PFAS exposure, between 2 and 20 nanograms per mil, the clinicians will give guidance on reducing exposure, which truly everyone should do. They will conduct cholesterol testing. It's also recommended to keep a close eye on hypertension during pregnancy, and at levels that are 20 nanograms per mil or greater. In addition to the cholesterol testing, it's recommended that a thyroid function test is conducted, and that they also assess and monitor for testicular and kidney cancers, as well as ulcerative colitis. So just to say that this is something that clinicians are now starting to incorporate into practice and become educated on, which is, again, not necessarily something that you would get in medical school. And again, we've seen a lot, this is some of the emerging research that has come from Mount Sinai and elsewhere related to PFAS, and that we have, that our clinicians, Dr. Maida Galvez and others at Mount Sinai, have taken out into clinical communities to educate clinicians. We also, I will share a link to some of the resources that we've created. We have a prescriptions for prevention program, again, to educate clinicians and patients about what they can do about these exposures. And we've advocated, at the state level to encourage stronger regulations around PFAS chemicals. And a lot of this has worked. And so the EPA, part of the new drinking water recommendations have come out of the EPA strategic roadmap for PFAS. There are a number of bills that have passed in New York State to reduce the use of PFAS, for example, in firefighting foam. This has been a major source of environmental contamination and also a risk for firefighters, now being eliminated for use in firefighting foam and food packaging. And most recently, actually, in this past week, the FDA announced that manufacturers are voluntarily removing PFAS from grease-proof packaging. So a lot of progress has been made. In New York, and I encourage you all to follow this. In New York, there was another recent bill that was just signed by the governor, prohibiting the use of PFAS in waterproof clothing, and some new legislation. And this is actually one of our partners, Bobby Wilding, who works with an advocacy organization, Clean and Healthy, and one of our pediatric partners, Chase Moon, in Albany, advocating in favor of this new legislation that would remove PFAS from more consumer products. So I'm going to start to close out, and we can, so that I can, potentially take a few questions. But what I want to leave you with is what we call our simple steps, because I know that this is, some kind of overwhelming and scary information, but actually there are a number of simple steps that you can take to reduce your chemical exposures starting today. One of those is that we know that you can track a lot of chemicals into your home on your shoes, things like pesticide chemicals that then accumulate in dust. And so using a sticky mat that you wipe your shoes on at the door, or better yet, taking off your shoes, leaving strollers and wheeled luggage and things like that at the door is one way to keep some of the chemicals outside of your house. Go to the next slide. Oh, similarly, washing your hands with plain soap and water. Recommend fragrance-free when possible. Sorry, I skipped. But at any rate, this is another way, particularly with children, not only to avoid exposure to germs, but to reduce chemical exposures. I don't know why this is so slow. But the next, okay, so the next tip that we have is to open your windows and have really good ventilation in your home. I talk about this a lot, but don't really have time to talk about it too much today. But indoor air, can be 5 times or more as polluted as outdoor air. So keeping, good circulation of fresh air by opening windows or using fans, range hoods when you're cooking, bathroom fans is one way to reduce a lot of exposures in the home. And fragrance-free, of course, this is a really key one that we talked about. Wet mopping and dusting, just trying to eliminate dust in the home as much as possible. So these are kind of the free and hopefully somewhat easy and not so burdensome things that you can do inside your home. And I mentioned a lot about advocacy, and I just wanted to point you all to a really great resource, Clean and Healthy, which is a New York State-based organization that sets priority issues across the state. They're a partner of ours through our New York State network. And have done like incredible work. Currently, they're working on lead poisoning, getting toxics out of menstrual products, more legislation around safe personal care products, and as well as recycling. So really encourage you all to check out the work that they're doing. They, in legislation that we supported at Mount Sinai, were able to pass the Child Safe Products Act to reduce toxic chemicals in children's products. And also, most recently, the governor just signed a bill to limit neonicotinoid pesticides, which is another issue that I talk about a lot, but don't have time to get to today. And then lastly, there's always good news. And that is that we really find that parents are incredible advocates around these issues. Consumer pressure has made enormous strides in the recent past with things like getting bisphenol A taken out of most food packaging and baby bottles. A lot of companies, again, are phasing out some of the most harmful chemicals and looking to replace these things. We need chemicals in our environment. We need these products, but can we do it better? As I mentioned, a lot of the chemicals that we're most concerned about really do come out of the body. And so when you make these small changes, you can have a big impact. And always, have to keep in mind that you can counteract the effects of, some of the harmful exposures that we have with positive exposures, like spending time together, reading with your child, getting physical exercise, and so on. And then lastly, I will just leave you, I can leave this up for a second. So I just wanted to direct you to our pages where you can get more information. So we have a lot of information for the lay public available at our Institute website and also at our New York State page. And you can find more information about the Westchester County New York State Center if that's of interest to you. Our Prescriptions for Prevention program, which is really geared towards giving you an action plan for reducing harmful exposures. We have some materials available for youth if that's of interest. And we are on social media, and actually we are no longer on, this should be X. We are no longer on X, but we are on LinkedIn. And so you can find our networks there. And lastly, I will just let you know that we have a number of webinars that we try to do for the public. We're celebrating Exposome Day in May with a presentation by Dr. Rosalind Wright from Mount Sinai, who will be talking about environmental risk factors and postpartum depression. She is the researcher that does a lot of the work looking at social factors and stress and how that interacts with chemical exposures to impact our health across the lifespan. And that's it. So thank you. And I will try to answer some questions, and I'll stop sharing.
Thank you, Dr. Evans. That was so informative and incredibly helpful. And I'm just going to give you some questions that we got off the Q&A while we have some time. One person asked, is there a database where we can check for specific products and see what toxins might be present in those?
Yeah, so the Environmental Working Group, which is at ewg.org, is a really good resource. They grade certain products. You can search by product, or you can search by ingredient, and it has a very in-depth information. Sometimes you can, if you're deciding between two different products, that can be a helpful way to pick the one that you think might be best. So yes, ewg.org. Is a good place to
One
go.
question was raised about having pets in the home and pet care, pet medicine. Is that an exposure to small children if you're petting them or coming off in the fur and dander of pets? Is that something we should be looking at as well?
Yeah, that's a tricky question. There have been there was just a recent, I think, recall of a pet collar, like a flea and tick collar. So I think I don't know too much about that. I would say if you're using like pesticide chemicals that you apply to the skin or that are present in a collar, then yes, that could be of risk to the child. I know sometimes it's an oral medication that pets take to repel ticks, and that can be a better solution. Yeah.
And if products are labeled organic or all natural, is that true? Can you trust that it has less chemicals or still could have some of these PFAS toxins?
Great question. I appreciate that question because that was something I didn't really get to. One thing that I usually tell people to be aware of is greenwashing. And so manufacturers can label anything natural, and they can use the term organic if they want to, particularly when it comes to products that are not foods. So it can be really tricky to know. So I usually recommend that you don't trust that unless you see a third-party certification that you trust. USDA organic, to carry the USDA organic label, you need to adhere to certain regulations, and so that's one way to know. But for your average, mattress or clothing or toy, or even personal care products, those terms are often thrown around in ways that are not meaningful. So you have to dig a little bit deeper.
And what about air purifiers? Does that help with the dust or anything to help minimize the
Yes. So then they can be expensive. So we don't necessarily recommend them to everyone unless there's a need. They can be effective. A HEPA filter is the gold standard. One thing that we caution against during COVID, we saw a rise in the use of air purifiers that used other things like ozone generating machinery. And so we just advise that you are very careful not to fall victim to any of those extras. But yes, an air purifier can help to reduce some air contaminants in the home.
And someone asked a question about the cholesterol testing for ages 9 to 11 and then older teens. Is that something that you guys have worked with the CDC to get it approved so that insurance covers it, or that it's a common practice in medical offices? How do we?
That's a great question. That's not something that I do because I'm not a pediatrician. But I love that question, and that's something that I could look into and get back to you, because I think there would be some burden for the clinician to justify, and I'm just not sure of the process for that. but that's something I can ask our clinicians. And
Someone else asked, is there safe food packaging?
is there safe food packaging? That's there's really no way to verify. Most of the most packaging has plastic, and plastic is a combination of many different chemicals that often can leach. So like I said, this recent Consumer Reports analysis found plasticizers, bisphenol A, phthalates in nearly every product that they tested that it actually got into the food. So I would say, the recommendation that we give is, choose as many, non-packaged foods as possible. And as many, whole and fresh foods as you can. But
Okay.
typically plastic is the culprit for exposures. And then again, these PFAS lined, a lot of takeout containers are lined with PFAS as well.
Okay. And is there a way, if someone wanted to get their phthalate levels tested, how would you go about that?
Yeah, we don't recommend that. The only place that is really done is in a research study. So if you were enrolled in a research study, that might be available to you. The main reason though that we don't recommend it is that it would be very difficult to interpret. We can assume, I think, that all of us have some level of phthalates in our body, and we know generally how to reduce them. So the recommendation really, rather than testing, is to just take the steps that we know will reduce your exposure. So things like not using fragrance in the home, reducing plastic use, and reducing the number of personal care products and cosmetics.
Here's a question I have about plastics. Are all plastics equal, like a plastic wrap versus a hard plastic, like you might have an orange juice container? Is that the same as cheese that's wrapped in a plastic bag kind of thing?
Yeah, they're all different. So for example, not every plastic baggie has phthalates, and that becomes confusing and kind of a misconception. And not all plastic wrap has phthalates either. So it's really, and I think most that you buy at home do not. A lot of the plastic wrap that's used commercially is made with PVC plastic. So a lot of the, like the foods that are packaged that you buy at the grocery store may have that kind of plastic wrap, but the plastic wrap that you buy for home use does not. It's very hard to know. Generally, plastics number 2, 4, and 5 are of less concern. 3 is PVC, 6 is polystyrene, or styrofoam. And so no, not all plastic, not all plastics are the same, but it can be really hard to know like which plastic you're using. So for example, the most plastic water bottles, disposable plastic water bottles, are number 2 plastic. So that's not necessarily a plastic that would be leaching phthalates. But that doesn't mean that we don't recommend that you drink plastic bottled water either, for a number of reasons. But
Okay. Someone asked a question, is it safer to buy products that have been made in the USA versus from overseas?
it just depends what you're talking about. So some products should be regulated here, in the United States. And so importing, for example, spices, certain types of foods, medications that haven't been approved by the FDA here can be risky. So it kind of just depends, I guess, what you're talking about.
Okay. Someone asked a question, you said a lot about is, fragrance and avoiding fragrances. How about scented candles that fall under the same category as to avoid?
Yes, and candles also have the added issue that anytime you burn something in your home, you're releasing gases and particulate matter. So even if it's a more natural or like a soy-based candle, you're still releasing things into the air that could be harmful if you inhale them. So we generally recommend against candles.
Okay, here's another question about Teflon and non-stick products. This is a good one. What about other non-stick tools like spatulas or just serverwares that have sort of that non-stick quality? Does that fall into the same category?
Yeah, I mean, I think they're best to avoid, but where you really, if it's something that is not coming into contact with the food for a long period of time, or getting very hot the way that a pan might, I would say that the risk is lower than a pan that you prepare your food in. Generally, for a number of reasons, including that we don't really want PFAS to be used in the manufacturing process, because that's one way that it gets into our water supply and contaminates the environment, and we can still be exposed. So generally, I would avoid, if you're buying something new, avoid nonstick in general. But if it's something that you have in your home that doesn't have a high exposure to food, I wouldn't say that you need to throw it out or not use it.
Um, okay, and someone asked, in lieu of plastic, glass containers, are they considered much safer choice?
Yes, absolutely. We recommend glass, particularly for heating. So one of the ways that you increase the release of chemicals from plastic products is by heating in the dishwasher or in the microwave. And so glass is much more stable and overall safer choice.
Are there other words we should be looking for in the ingredient lists that we should, be a red flag?
I would say, I mean, yes, I would say, one other big class that that we recommend against is antibacterials. And so we didn't really talk about cleaning or cleaning chemicals, but avoiding there's a class of chemicals called quaternary ammoniums that are used in a lot of antibacterial soaps and cleaning chemicals. They really don't give you a huge added benefit over, plain soap that's not antibacterial. But again, kind of like greenwashing, I think sometimes we're compelled to buy like the strongest disinfecting chemical, but we actually don't need it. So any of those, and you can look it up because there are like a number of them, but the quaternary ammoniums, benzalkonium chloride is a common one. If you look at the active ingredients label on a soap or a disinfectant, and you see any of those, I would make a different choice.
Okay. We have a couple minutes left, so I'll ask a few more. We have a lot. Masks, now that we're using masks more, continuing to use masks, is that safe?
Again, so that's like a lot of things, that's a sort of a risk benefit equation. There was concern about masks, surgical masks having PFAS chemicals, actually, or potentially other types of chemicals that it might expose someone to. But that low short-term exposure compared with potential hospitalization with COVID, particularly if you're a vulnerable person, is kind of like a risk benefit. So yeah, and there's also the the environmental impact and the waste with using so many masks that it was important to be cognizant of. But no, I would say if you need to avoid infectious disease, that the mask was necessary, and driving industry towards making a safer product is one way to tackle that, I think.
Okay. Let me see a couple of questions about aluminum in deodorant and aluminum foil. Any thoughts about those products?
Yeah, so I hear that question a lot. The data, the evidence that supports the health risks of aluminum through deodorant or foil or like cooking equipment is not very strong. So we don't really have concerns about that. There are alternatives for deodorant. There are some alternatives if that's something that concerns you, but the weight of evidence is not very strong to show that there is a health impact.
Okay, and thermos types of to-go food containers, plastic containers, I guess, like the plastic Tupperware kinds of things. Is that when they start to get oily, or they can hold on to the residue of food, is that a sign of leaching, or those best not to use those types of plastic containers?
Yeah, they could be. I know those are they do break down, particularly if you heat them often in the dishwasher. And that is a challenge because even if you use stainless steel, often the lid is plastic, right? So I would say yes, if you see like noticeable degradation, that you should replace it and try not to heat or put them through the dishwasher.
All right, well, it's 1 o'clock, so we're going to respect your time and sign off. But there was a ton of questions, so if anyone still has further questions, we've posted your information and slides on the Herd and Rye website, so everyone go check that out. And again, thank you so much. This was extremely helpful information.
Okay, great. Thank you so much.
Bye bye.